topics that are very important. More children in Florida are going without health insurance. That's a fact. It's a trend that experts say is likely to grow. And we're looking at why this is happening and what it means for families having to choose between medical care and daily basic needs. About 8.5% of children across the state of Florida had no health insurance last year. That's roughly 403,000 children, a spike of 20% from 2022, according to an analysis of census data from Georgetown University. That means that those children likely missed out on regular doctor checkups, vaccinations, and other essential health services. The rise in uninsured kids is tied to a stalled expansion of Florida's Kid Care program, approved by state lawmakers 2 years ago. A legal dispute with the federal government over how the program handles premium payments has had it on hold ever since. It's created gaps in coverage for families who can't afford private insurance. Health advocates warn families coping with chronic illness are the hardest hit, and the financial burden of even simple routine care is forcing some parents to delay or skip critical checkups for their children. The independent nonprofit Florida Policy Institute encourages people to reach out to their legislators and share stories of their health care challenges. Mike, as a former legislator, I'd just like to start with you. When you hear that this is something, the Kid Care program was approved in the legislature in 2023, and now there's a holdup going back and forth with the federal government. As a legislator, how does that sit with you?
It's very sad. Kid Care is probably one of the best programs we have in the state of Florida. The legislature and the governor puts something in place that allows every child in Florida to get health care, health insurance. To see what's happened now, and I don't want to blame Republicans or Democrats, it concerns me that the federal government and the state government can't get their act together. As thousands of children come off of health care, health insurance. I mean, it's not just kids who just need an annual checkup. We have chronic children whose parent is getting letters saying that we're no longer going to be able to insure you starting this month or next month or whenever. And there's the parent now wondering, how is my chronic ill child, how is that my child going to get the care that they need, not only monthly, but weekly, some daily? And I feel badly for the parent. I mean, children are the most precious thing that we can, to take care of. And the state of Florida can easily, $115 billion budget they had this year, and they can't take care of our uninsured children. It's the easiest thing to do.
So if a mom and dad changes jobs, and they get new insurance, legally, that new insurance company can say, we're not going to cover that in your child because that's a pre-existing chronic illness?
So that's a very interesting question, and there are changes in that law regarding pre-existing conditions. But what this story really is about is the fact that the state of Florida is not expanding its health insurance program for children like they did under COVID. And that's where the rub really is that it's an easy fix. It's a bipartisan fix with all the things that are going on in the world. We can all agree, no matter where you are, that we care about our children. And the Florida has the Florida budget, and they have the ability, because we did it like that under COVID, to make sure that I think it's something like 500,000 children, majority of which would still benefit from the Florida's Children Health Insurance Program. So go ahead and make that change and immediately help those kids get care. It's an easy win. It's a great bipartisan effort, and for the most important part, it helps serve our Florida kids.
How effective is it when residents reach out to their elected officials in Congress and say, please move this along?
Well, calls matter. Going up to Tallahassee, and there are a lot of organizations that do matter. Having face-to-face conversations with your legislature matters. This is just another huge test of the Florida legislature and for Governor DeSantis, because the need is obvious. The bipartisan feelings about this are obvious, and it's going to be a real question about when the legislature comes back into session. Are they going to continue on their path in terms of social issues that don't solve real problems, or are they going to provide health care for our children? There is nothing more important about that, and that's really kind of a test, Lissette, of us. Are we going to demand this of our legislators and our governor? And if you're concerned about what you just heard, then pick up the phone and weigh in with your state legislator.
Even if you don't have children, I don't have kids. I got nieces and nephews, but I don't have children. It's like, call your local legislator, go and see them,
it's
write them a
interesting that
letter,
we're all
email
saying
them.
It's a moral and a faith-based
Absolutely.
imperative. And we spend so much time in the state talking about moral and faith-based imperatives, caring for our children, making sure they have access to health care. There's nothing more important.